Welcome, Dr. K.
Hi, thank you for having me. I'm Dr. Kanan, the owner and dentist here at K Smiles Dental Care, and I'm here hoping to answer your questions about implants. So ask away.
First off, what exactly is a dental implant?
A dental implant is a titanium fixture that is used to hold on to something. So for example, here we have a dental implant. Okay, that's the gray part. Actually, I have a real life one. This is how tiny it is, okay? And this tiny little thing is going to hold on to anything that we need to hold on to. For example, we can put a single crown on it. You can put a bridge on it. And in some cases, we actually can put a whole set of teeth on them. Now, the great thing is you don't need one implant for each tooth. Like in this case here, it's a 12 teeth, so it's a full set of teeth, and it's hanging on to 4 implants. Sometimes we put it on 5 or 6 implants, depending on your specific situation.
That's fantastic. Are there any situations where dental implants might not be recommended?
Not everybody is a candidate for dental implants. So at the first visit, we do a consultation where we review the medical history, we take a look at the x-rays. For example, patients who have diabetes that's not controlled, your risk would be higher than someone who has diabetes that is controlled or someone with no diabetes. Another example is heavy smokers. When someone is a heavy smoker, there's less oxygen and blood going to the area, so the risk of failure is higher. Another example is people who are being treated with certain medication used for osteoporosis. Also comes with higher risk. Now again, in all of these cases, it's not impossible, it just comes with more risk. Good news is, if you're not a good candidate for an implant, there are other options.
Can an implant be placed immediately after a tooth is extracted?
Yes, it can. Now, in some cases, if the bone looks good and everything looks healthy, like there's no infection in there, we can remove the tooth and place the implant right away. This is my preference when it's possible, of course, because my main goal is to have something successful, okay? That's our number one goal, is how can we increase the success of this implant? So if everything looks good, we remove the tooth and place the implant right away. In other cases, it's better to remove the tooth, let it heal, and then come back in a few months and place the implant. So it all depends on your specific situation.
How painful is the procedure?
Good question. Actually, I get this question a lot. With dental implants, we only need to use regular freezing because it's a fairly comfortable procedure. We're actually trying to be as gentle as possible. Most people go right back to their normal routine the next day. So I wouldn't worry too much about the discomfort. Now, let's say you are worried. It's okay. I mean, we have patients who get nervous and anxious about this, you know. So we do have other things we can use. For example, we can do moderate sedation, where you come in, you take a tiny little pill, and it just helps you feel more relaxed and calm. And we can also combine that with laughing gas if you choose to. And I've had some people who even fall asleep during the procedure, and we're waking them up when it's over. So whatever it is you need, we have that discussion at the consult appointment.
Another common question, what types of implants do you use and how do they differ?
Oh, very loaded question. So there's actually thousands of implants around the world. Many of them are not even approved in Canada. And obviously they vary in costs as well. The type of implant that's used is extremely important because, you know, you're putting something in the mouth that the body has to accept, okay? So here at K Smiles, we use just top of the line implants. We use Neodent, which is by Straumann. very reputable company that's been around for decades, as well as BioHorizon, also very reputable, strong implants as well. So you should always look into what implant is your doctor placing, because this is something that, you know, when you're placing implants, you want it to last for many, many years, if not a lifetime. So it is really important that you get quality product placed.
Is there a chance the body could reject the implant?
Yes, implants are not 100% successful. Failure is rare. It happens 2 to 5% of the time. So the success rate is actually quite high, you know, at 95 to 98% success rate. And it's one of the most successful procedures we do in dentistry. But again, in rare cases, they can fail. So what happens if it fails, right? What happens is that you lose some bone around the implant, so it becomes loose. And we just take it out, clean it up, and either we try again and place a new implant, or we look at other options for you.
Can you walk us through the stages and timeline for getting an implant?
Absolutely. So the timeline changes depending on how many implants we're placing or what kind of prosthesis we're putting on top of it. But generally speaking, it could be anywhere from, to get your final prosthesis, anywhere from 4 months to a year.
How does this procedure work at your clinic?
At our clinic, we have a process for implants, and this process is designed to make sure that you're as comfortable as possible and that we get the best result possible as well. First visit is a consultation to understand what your needs are and what you're looking for. At the same visit, we do a digital scan, we take photos so we can design your smile, and we do a CBCT so that we can see a full view of what the area looks like, because every missing tooth is unique. Once we have agreement to move forward, your next visit will be to place your implant. Now, at this visit, we do use freezing so that this process can be painless for you, and we offer a comfort menu, anywhere from a warm blanket to laughing gas, to make this as comfortable as possible for you. Once the implant is placed, in some cases we can even do an immediate temporary tooth for you, so that after, when you walk out of here, you may have a tooth right away. After about 4 months, so when everything's healed up and ready to go, then we do your final crown. We design your smile so that no one can tell that this is an implant or a crown.
What can patients expect after getting an implant?
Great question. So after the procedure, you're going to have some instructions to follow just to keep the area protected. The amount of discomfort is very minimal, and most of the patients are back to their routine activities the next day. Of course, you need us or you have any questions, we're here to help at any time.
And final question, how should patients take care of their dental implants?
You treat your dental implant like any other natural tooth. You want to be sure that you're brushing twice a day and you're flossing in between the teeth. You can't get a cavity on an implant, but it's important that we're keeping the gums and the bone healthy around it. So brush and floss regularly.
Thank you so much, Dr. K, for answering all the questions.
You're welcome. And for everyone listening, I really hope that this information helps you make a decision about whether implants are right for you. And please remember that I am here to answer any other questions you might have. And actually anyone here at K Smiles Dental Co will be able to give you the information you need.